Hello guys, welcome back to Top Lesson for You. Dear friends, as we are discussing about the blood supply of the lower limbs, right? So in the previous lecture I discussed about the branches of the femoral artery, right? In the lecture before that we discussed about the branches of the external iliac artery. Now moving further down, you can see I have drawn the knee joint here, right? And we will see the blood supply of the knee joint. Superiorly to the knee joint at the femoral region, we have discussed all the branches of the femoral artery and its branches and the blood supply of that region, the thigh region, right? Now we are discussing about the blood supply of the knee joint or the knee region, and then we will move further down towards the leg and towards the foot, and inshallah we will discuss complete the blood supply of the lower limbs, right? Now let us begin our lecture regarding the blood supply of the knee. Okay, before going to that, friends, if you are watching us for the first time, it's a humble request that first of all please subscribe our channel and please share our videos with your friends. Thankfully we will be very thankful to all of you guys. Then friends, if you haven't watched the lectures regarding the superior parts, the thigh region and the branches of external iliac artery, so it's a humble request, go and watch those lectures so that you could be easily relating those lectures with this lecture, and it will be easy in understanding to know about the blood supply of the lower limb, right friends? Let us begin our lecture. So look carefully. As you know, in the previous lecture we said that the femoral artery moving down and gives two important branches, right? The popliteal artery and the descending genicular artery, right? Now our aim is to discuss about the branches of the popliteal artery and the descending genicular artery. Then we will complete the blood supply of the knee joint. Let us discuss about the popliteal artery. First we will see popliteal artery. Then we will see the branches of the descending genicular artery also. Look friends, here is our popliteal artery. You can see this one is our popliteal artery. So one thing I should mention here that I have drawn two types of drawings. One is the dark drawing and the other is the dotted way or dotted manner drawing. Look carefully. This dark way represents that it is present in the interior of the thigh, of the knee joint, right? And this dotted manner shows that it is present in the posterior, right? As you can see, this is the interior view, this is the posterior view, and here is the lateral view, right? So we will see all these branches, So this dotted line shows that this artery is present on the posterior aspects of the knee joint, right, as I have shown it here in the posterior aspects. Next, this dark line shows that all these arteries are present in the interior aspects of the knee joint, right? So look carefully, what is popliteal artery? Here you can see this is the greater magnus muscle, right? At the end of this greater magnus muscle, this femoral artery gives off two branches. You can see here, this dotted line shows that it is the popliteal artery, and here we have the descending genicular artery. So let me first of all name these two arteries, then we will see all those branches. First of all, look carefully friends, this one is the descending genicular artery, done. And this one which is present posteriorly, right, this is our popliteal artery. Popliteal means the fossa behind the knee joint, right? This is called popliteal region. The fossa which is present behind the knee joint, this part, this is the posterior view, right? This is called the popliteal fossa. So the artery which is going to popliteal fossa is called the popliteal artery. So the femoral artery, this one is our femoral artery. Let us name it also, this is femoral artery. Right. So the femoral artery will give off two branches. One will come medially, anterior-medially, and the other will go posteriorly. So the posterior branch is called popliteal artery and the anterior-medial branch is called the descending genicular artery. Now as you can see, this descending genicular artery has given off two branches, right? This is which is very medially, and the other branch is here which is a little bit medially but medial to this or lateral to this artery, right? So what is the name of this branch which is given by the descending genicular artery? That is called the saphenous branch, right? Let me name it here as saphenous branch, and we will see it in a while. Right, this is the saphenous branch of descending genicular artery, and this one is coming to the knee joint, articulating here. That's why we call it articulate branch. Right, this is the articular branch. Done, friends. In anatomy, what is the most important thing? The most important thing is diagram. If you know the diagram, then you can remember all the things easily. Right. So look, this is femoral artery. Then the femoral artery gives off two branches, the descending genicular artery and the popliteal artery. We will see the branch of popliteal artery in a while, right? Then this descending genicular artery gives off two branches, the saphenous branch, which is medially, and the articular branch, which is lateral to the saphenous branch, and it comes and makes anastomosis and is articulating around the knee joint. Clear, friends? So we will see this artery lateral. Let us discuss about the popliteal artery. What is popliteal artery? First of all, friends, it is a branch of the femoral artery, right? I'm writing it a little smaller, then we will inshallah see branch of femoral artery. The popliteal artery is the branch of femoral artery. Very good. Where does this artery arises? What is the origin point for this artery? So the origin point for this popliteal artery, as you can see, friends, this is our adductus magnus muscle, right? This muscle shows the adductor magnus muscle. At the lower end of this adductor magnus muscle, this artery bifurcates from the femoral artery, right? So it arises at the distal portion of a distal part of adductor magnus muscle. Clear, friends? Now what is the length of this artery? Its length is about, from the point of origin up to the point of bifurcation, its length is about 19 centimeters. Right, and the diameter of this artery, its diameter is about 7.4 millimeter. Clear? Now what are the branches of this artery? Let us know about the branches of the popliteal artery. Clear, friends? So popliteal artery gives off many branches, about 5 branches completely, or we can say about 7 branches. We will see now. The first branch, which is called the superior medial genicular artery. Let me write it here, then we will show you there. There is superior medial genicular artery, right? I hope when you watch this lecture completely, you will remember all those branches easily. So superior medial genicular artery, look carefully. First of all, there is the word superior, which means up. Then there is medial. So you have to remember these two things. Genicular artery is same for all, right? So superior medial, let's see, friends. This is our medial aspect, right? Medial aspect of the knee, and this is the lateral aspect of the knee joint, right? Here is the superior part, here is the inferior part. Now look carefully. I have written superior medial genicular. It means that this artery is present in the medial aspects of the knee joint. Look carefully, friends. As you all know that this popliteal artery is present in the posterior aspects of the thigh, right, of the knee. Then you can see here these branches, this dotted manner branch. Look, when it comes interiorly, it becomes darker. It becomes darker. So it arises posterior to the knee and comes interior. Look at this artery here. Look friend, this is the posterior view. So in posterior view, you can see this is our popliteal artery. What is this? This is popliteal artery. Clear? This will be its lateral view, lateral aspect, because fibula is present laterally, and this will be its medial aspect. Right? Look carefully. Popliteal artery goes to the popliteal fossa and it gives the first branch, this one, which is present superior to this knee joint. We call it superior. Then it is present, then it is going medially, that's why we call it superior medial genicular artery. This one is superior medial, which is present medially, genicular artery. Now look here, this is our medial aspect. This artery arises in the posterior, this is posterior view. Clear? Posteriorly. So it arises posteriorly to the knee joint, right, and comes interiorly. So this artery arises posteriorly, that's why I have mentioned it in dotted manner, as I told you before, and it comes interior, so we call it superior medial genicular artery. So this branch, let me name it here, this artery, then you please focus on it. This is our superior, right? This was the first branch given by popliteal artery, the first branch. Then there is the second branch which is given by this artery, by the popliteal artery, that is the superior lateral genicular artery. You can see this is coming to the lateral point, to the lateral side. Look, it arises posteriorly, that's why I have mentioned it in dotted manner, and it comes interiorly, then it becomes darker. Right? So what is this artery? This is our superior lateral. It is present lateral genicular artery. So superior medial and superior lateral genicular artery. Superior lateral genicular artery. Done. Then there is the third branch of this artery, which is called the medial genicular artery, the third branch. Look carefully friends, that medial genicular artery will be present somewhere in the middle point of the knee joint. So we can't mention that artery here because we are looking at the interior view, but we can see it in the lateral view. Right? Look carefully friends, this is our superior medial genicular artery, superior medial genicular artery, right? Then on that side will be the superior lateral genicular artery, and this one is our middle genicular artery. Middle genicular artery. I hope it is clear to you guys in this lateral view, in this medial view of this knee joint, right? So it will be present somewhere here, and it will enter to the to the joint, and it will supply blood to the synovial membrane, right, and the ligaments which are present there, right? So look, it will be here, and from the posterior side it will be entering into the knee joint to supply blood to the knee joint. So there is the middle genicular artery. Middle genicular artery. Okay friends, then the fourth branch from this popliteal artery, look here friends, there is superior medial genicular artery, there is superior lateral genicular artery, then on the central point there was middle genicular artery, and you can see this artery, this one and this one. Clear? This, look, they are arising from the popliteal artery. That's why I have mentioned in dotted manner. So these two arteries are shown here, right? So these are present inferior to these arteries, inferior to the knee joint. That's why we call them inferior, right? And this is present on medial side, inferior medial genicular artery, and this one is present on the lateral side. That's why we call it inferior lateral genicular artery, right? So the fourth branch is called the inferior lateral genicular artery. Clear, friends? So here is our inferior lateral genicular artery. Inferior lateral genicular artery, and this will be our inferior medial genicular artery. Clear? So then there is the fifth branch which we have written here is the inferior medial genicular artery. Genicular artery. I hope you are understanding. So up to now we have discussed 5 branches of this artery. Now look carefully. You can see in the anterior view all these branches, these small branches, these are the anastomosing branches which are present. We will see inshallah in the next lecture that what are the anastomoses which are present in the knee region. We will see this video also. So look friends, this is our inferior medial genicular artery. You can see it's coming anteriorly. Then there is inferior lateral genicular artery which is coming also anteriorly and making anastomosis with all these arteries, right? Then there is, look, this is our popliteal artery, then it gives a tibial artery, right? This is our tibia, so this is tibial artery, the posterior tibial artery, and then it also gives another branch which comes anteriorly to the tibial bone. That's why we call it anterior tibial artery. So the sixth branch from this artery is our posterior tibial artery. Posterior tibial artery. This is the sixth branch. And number 7th branch from this popliteal artery is this one, look, and it is coming anterior to the tibia. That's why we call it anterior tibial artery. Clear, friends? So how many branches are all the branches from the popliteal artery? There are about 7 branches from the popliteal artery, right friends? This was about the branches of popliteal artery and the blood supply of the knee joint. Now look, one thing more friends which is very important to mention. This artery you can see separates and goes superiorly, right? Look carefully. This artery from the anterior tibial artery separates and goes superiorly. This is called the tibial recurrent artery, right? So what is this artery? This is our posterior tibial artery. This is our anterior tibial artery. Tibial, right? And this will be our tibial recurrent artery. Tibial recurrent artery, and it is anastomosing with the inferior lateral genicular artery. You can see this is our, it is anastomosing with the inferior lateral genicular artery. You can see here, right? So this is our tibial recurrent artery. Clear, friends? Now next, what is this artery? It is coming down and anastomosing with the superior lateral genicular artery. This artery is the branch of it is the branch of the lateral circumflex femoral artery, right? You can see here, right? So this was our lateral circumflex femoral artery, and this was our medial circumflex femoral artery from the previous lecture. So this lateral circumflex artery will give off three branches: the superior branch, the transverse branch, and the descending branch, right? The ascending branch, transverse branch, and the descending branch. So this descending branch has come down and it's giving muscular branches to the thigh muscles, right? And it is anastomosing with which artery? It is anastomosing with the superior lateral genicular artery, you can see here, right? So what is this artery? This is the descending branch of the lateral femoral circumflex artery. You can see this artery, you can watch that lecture to make a clear concept about this artery also. So let me name it here. What is this? This is the descending branch of lateral femoral circumflex artery. You can see it in the previous lecture. Right, friends, let us see this diagram and see all these arteries which we have drawn, right? So firstly we repeat, what is this? This is the middle one is popliteal artery, right? As this is the medial aspect. So what is this artery? What will be this artery? This is our superior descending genicular artery. So what is this? This is descending genicular artery. I will show you this artery there, then you will understand what is this. Look, from here we go to here, right, friends? So if you can see here, this is our femoral artery. So this femoral artery has given two branches. How many branches? Two branches. The the descending genicular artery and the popliteal artery. So if we clear our diagram here, we join both of them like this, right? So what is this? This will be our femoral artery. This is femoral artery. This is our descending genicular artery, and this will be our popliteal artery. It's quite easy, right? So this is the posterior view, right? Then this will be our saphenous branch, and this will be our articular branch. I have mentioned them there, and we will see the branches also while we are discussing about the descending genicular artery in the next lecture. What is this artery? This is the descending branch of lateral circumflex femoral artery, right? And what is this? This is the superior medial genicular artery. This is the superior lateral genicular artery. Here will be our middle genicular artery. This is the inferior medial genicular artery. This is the inferior lateral genicular artery. This is the tibial artery, posterior tibial artery. So this is the posterior tibial artery. This will be anterior tibial artery, and then we will see the branches of them, the fabular artery also. We will see them in the next lecture, right? Then let's come here. What is this, friends? This artery is our popliteal artery. This is our descending genicular artery. We are looking at from the lateral view, right? This was the anterior. I'm sorry, this is not the knee, but let us consider it. This is the interior, posterior, and now we are looking from the lateral, from the medial side, right? So this is our medial view. Let me name it here, medial view. Right? This is anterior view. Anterior view. Right. So in the medial view, we can see this is popliteal artery, this is descending genicular artery. The descending genicular artery gives off a saphenous branch and an articulate branch. Right, clear. Then the popliteal artery gives off the superior medial genicular artery, middle genicular artery, and the inferior medial genicular artery, and same will be the case on the lateral side, right? Then there is the posterior tibial artery and the inferior tibial artery. We will see the branches of these tibial arteries while we are discussing about the blood supply of the legs, right? So friends, this was about the branches of the popliteal artery in the knee region. Now in the next lecture we will discuss about the branches of the descending genicular artery, and we will complete the blood supply of the knee joint. So see you in the next lecture. Till then, bye bye.